Good day to you where they watch us from anywhere in the world. Welcome to CHRICED Radio and Television, where your matter now we own. This now another episode of Kajad Body for All, the program where they take your health matter serious because better health now better life. My name na Falila Tadamu, your host for this show. Today we dey talk about something where plenty women they face quietly. Wetin be fibroid? Yes, you heard me right. Wetin be fibroid? Fibroid na growth wey dey grow for woman womb. E no be cancer, but e fit cause serious wahala like heavy bleeding, pain, and sometimes delay for pregnancy. Fibroid common well for African women, especially women between age 30 to 39 years. Fibroid, according to statistics, fibroid dey affect 20 to 50% of Nigerian women wey dey reproductive age, that's between 15 to 49 years, and some estimates even show say up to 80% of women fit get am before age 50. And for hospital matter, fibroid accounts for 10% to almost 30% of gynecology admissions. And for some teaching hospitals for Nigeria, fibroid be the number one reason where dem dey remove womb, where they call am hysterectomy. And for all this yarn wey we wan yarn today, we get one correct doctor wey go help us scatter this matter for me and you to understand. She na resident obstetrics and gynecologist, and her name na Dr. Radia Bashir Kazim. But before we welcome her, we will go on a very short break. No go anywhere. Welcome back to Kajad Body for All on top CHRICED Radio and Television. Don't forget to watch us live on YouTube and Facebook at CHRICED Radio TV. And if you want yarn the color of your belly, send us message for WhatsApp where the number now 09068918345. And I will take them again 09068918345. Now, make we welcome our doctor, Dr. Radia Bashir Kazim. Dr. Radia, welcome to CHRICED Radio and TV. Please, can you hear me, ma'am? Can you be audible? I cannot hear you. My viewers cannot hear you. Hello, Dr. Radia. Hello.
my Naija people. Now on a babe Fali Tiger be this. I deal with now on top CHRICED Radio and TV. It is sweet me for belle to come see and hear wetin dey pepper una for body. Una go to see they see me for that una area to come talk about wetin dey bother una for mind. You know, NDL, it get any mago yarn what I want to talk about. I be how una see this government economy matter for market. Your babe Fali Tiger ready to hear una out. Just listen and watch us on www.CHRICEDRadioandTV.com and follow all our social media platforms. Just search CHRICED Radio and TV everywhere. On top CHRICED Radio and TV, on a matter now we own.
Welcome back. Like I tell you before, join this conversation online at CHRICED Radio TV. And if you want yarn the color of your belly, you know anything about this topic, send us a message on WhatsApp, where it's 09068918345. Now make we welcome our doctor to the show. Dr. Adia, good to see you today. Welcome to CHRICED Radio and TV. Hello, doctor. Can you hear me, please? Please, can you be audible? I can't hear you. I can hear you faintly, but it's not audible. Hello, doctor. Okay. So, like I tell you before, in case you don't know, say statistics say fibroid affects 20 to 50% of Nigerian women with their reproductive age, that is around 15 to 49 years. And some estimates even show say up to 80% of women fit get them before they even clock the age 50. And for around hospital matter, fibroid accounts for 10% to almost 30% of gynecology admissions. Just imagine that. Women, they go through a lot. And for some teaching hospitals, fibroid be the number one reason why they remove, why they do hysterectomy. I hope I say I pronounce that right, because I know I not be doctor. That's every doctor make it come tell us all the cocoa about this fibroid thing. And if she can hear us, she fit tell us wetin be the meaning, wetin she understand by fibroid, and also educate you, my viewers, wetin fibroid mean. Because some women get this fibroid, but I be like say wetin, according to wetin I read, women get am, but they no know say they get am, because everything for their body go dey fine, go dey cool, okay, and everything until gbege go start, and that time the fibroid sef don already big, don go far. They call am I think the word na asymptomatic. So doctor go tell us wetin that one mean, and go break this matter down for us, make we understand. And before we welcome her to the studio, make we take a very short break. No go anywhere. sorry for that small break in transmission. You know, as they be for Nigeria and network here and there, but I think we don't back fully now. So maybe we welcome our doctor to the studio. Dr. Radia, hello, can you hear me now?
I can hear you perfectly. How are you?
Oh, thank God. So, Dr. Radia, we dey talk about fibroid matter today. The thing where be say some of women self no know say them get them. I bet you fit educate my viewers wetin fibroid be.
Okay. Fibroid is actually a benign tumor of the uterus, meaning tumor is any growth, anything wey swell inside the woman womb. So fibroid is when the smooth muscle, you know there are muscles everywhere. Okay, just like beneath the skin, there is muscle everywhere in your body. Even the uterus has its own muscle. So when that muscle begin to grow more than how it is supposed to be, then we call it fibroids. And it is benign, meaning it is not cancer. It is not
Okay.
malignancy. It's just a benign tumor of the smooth muscles of the uterus, because the uterus has many muscles. It has the inner lining, it has the muscular layer, it has the covering of the uterus. So that's circular muscles of the uterus. If there is growth in it, that is called uterus. But this no be cancer. It doesn't cause cancer, and it is not a cancerous lesion.
Okay, thank you very much. And please, again, tell us who fit get cancer as a woman.
Pardon?
As a woman, which age it dey possible say person fit get cancer?
Any age you can have, even women, younger children as 8 years, 9 years, 15, any age you can get cancer. But
Wait, 9 years fit get if 9 years fit get sorry, I missed the word, not cancer. 9 years fit get fibroid.
No, okay, any woman in the reproductive age group fit get fibroid, because these fibroids, the food of the fibroid, what sustains the fibroid is the hormones in the body. That is estrogen and progesterone. These are the hormones. And every woman in reproductive age group, as you have said, from 15 to 49, has that hormone, meaning it has the food where the fibroid feed chop. So any woman within 15 to 49 years can get fibroids. Even more than 49 years, even women in their 50s, they can get fibroid, but it's more common in women in their reproductive age group.
Okay, now this fibroid wey we dey talk about na hereditary. Because say my mama get am before, mean say if I don't grow reach the age, me sef I fit still get am. Okay, but this fibroid now, wetin I wan know be say if it cause infertility for woman, when woman no go fit carry belle.
So the cause of infertility and fibroids, it's usually a casual relationship, meaning they just happen at the same time, but it's not a causal relationship. However, there are certain ways where the fibroids fit cause infertility, or the infertility can cause the fibroids, right? Because it's been said that the empty uterus is a home for uterine fibroids. As long as there is no baby inside that uterus, there is nothing to oppose that hormone. During pregnancy, the estrogen usually subsides and the progesterone overtakes. So if you're not pregnant, or you have never been pregnant, right, or you have not gotten pregnant for a long period of time, that is also a risk factor for uterine fibroids, because the uterus has been empty and the estrogen has been there acting on the uterus. So that can give you uterine fibroids, right? So it's not the fibroids per se really that can cause the infertility. Sometimes it's the infertility that causes the fibroids. Sometimes it's the fibroid that causes the infertility. So it can be a two-way thing. How the fibroid can cause infertility, it depends on the location of the fibroid. As I have told you earlier, the fibroid has the uterus has many layers. If this fibroid happens within the inner lining of the uterus, where the baby feet implant, right? Where the baby feet stay, if it is that place that the fibroid occupies, there might be recurrent miscarriages in that. Right? The patient would get pregnant, and the pregnancy would lead into miscarriage because of that fibroid. Another thing is that there is a certain period of time where the sperm will enter the human body would reach the egg, right? But this fibroid would make the uterus to be big. As the fibroid big, so the uterus would be big. So the time it would take the sperm to travel from maybe the cervix into the fallopian tube where fertilization feet occur, it takes a long period of time. That's why some of the sperms would die before they reach the egg. So that can also cause infertility for you. right? So
Okay.
these are some of the ways where the fibroid can cause infertility, and the infertility too can also cause the fibroids.
Okay. Thank you. Like wetin I don learn today now, say people dey talk say fibroid dey cause infertility, dey cause infertility. You don hear my doctor now. She say fibroid fit cause infertility, and infertility again fit cause fibroid. And again, e get where the fibroid go dey place for the woman body, where e be say sperm no fit travel to that side. Before e reach there, the fibroid sef don kill the sperm. And doctor, some people dey talk say too much abortion e dey cause fibroid. How true is that?
No,
See, when
it is
woman do
not true.
abortion.
No, abortion does not cause uterine fibroids. As I have told you today, fibroids feeds on estrogen and progesterone. So as long as you have this estrogen in your body that is much, so you are at risk of having uterine fibroids. But abortion no fit cause infertility at all, at all. No
Okay.
fit cause uterine fibroids.
Okay, but they say na womb wey dey empty na im dey cause fibroid. What of woman wey be
Yes.
say she don born finish, she don even born 5 children, and yet later she can't get fibroid? That one possible?
Mm. Yes, it's
Okay.
possible. It's also very possible.
Because the womb dey empty.
Yes, as long as the womb is empty. And there's some people that might even be pregnant and have the fibroid because they had the fibroids before the pregnancy. So during the pregnancy, some fibroids would remain unchanged. Some will even shrink because the progesterone would not let the fibroid grow. And some will even increase in size during the pregnancy. So anything can happen during pregnancy. Some fibroids would shrink, some would remain unchanged, some would increase in size during the pregnancy.
So how woman wan take know say she get fibroid? Because some go sit down, they no even know say fibroid dey their belle sef until maybe the thing don over big, come dey disturb them.
It depends on the size of the fibroid. It depends on the site of the fibroids. Okay, so in some women, it's asymptomatic. You can even have fibroids without having any symptoms of fibroids. You don't have any problem and you don't even know there's a problem. You can only detect the fibroids when you go for a scan, and the scan will tell you, okay, you have fibroids, because the fibroids are very small. If you take a section of women, more than 50% of women over the age of 25 would have some, maybe a seed, just like a mustard seed of fibroids in their body. But they are too small that they don't cause any symptoms, and that's okay. You don't intervene, you don't take drug or anything because it's not giving you problem and it's too small. Another determinant is the location of the fibroid. Lines the inside of the uterine cavity. It can cause a lot of things. It can cause, number one, there might be menorrhagia. That is, you would be bleeding excessively during your period. Instead of you to wear like 3 pads in a day, you would start wearing maybe 6 pads in a day, and every pad would be flooded with blood. The blood would be a lot on the pad. It can also cause bleeding with blood clots. It can cause dysmenorrhea, that is excessive pain. Your tummy would be paining you during the period pain. So that would cause excessive pain during your periods. Another symptoms might be you might have pain while being intimate with your partner. During intercourse, you might have pain deep inside you. So that can also be a fibroid. Another thing it can cause is there might be abdominal swelling. When you touch your abdomen, you would feel something growing inside you. Even you by yourself, if you touch them, you would see that there is a swelling inside the stomach. So that can also be a symptom of the uterine fibroid. Then subfertility, some of them might come with problem with conception. And other things include the problem with complications that have already occurred, especially for fibroids that are very big. These fibroids, they have some connections with ureters. This is the pipe that carry urine down to the bladder. If they're huge enough, they can cause obstruction of the ureters. They would prevent the urine from flowing down to the bladder, so they can have problem with their kidneys, right? Urine would be going backflow of urine, obstructive uropathy. They might come with kidney problem. They might obscure the drainage, lymphatic drainage of the legs. So the legs might be swollen if the fibroid is big enough to cause lower limb swelling. And it also depends on the location. It might compress the rectum where we store our feces. So they might have constipation. And sometimes they might have diarrhea if it's irritating the rectum. It can also irritate the bladder. Some of them would have increased urge to pass urine. They'll be going to the toilet frequently. Some might have pain in passing the urine. So these are all complications of the uterine fibroids. And some of them might come with difficulty in conceiving. That is the infertility.
Ha, you don't hear am. Say fibroid, if you not go check am, they cause many health issues. Like instead of urine to dey come out, they go back to the bladder, and that one na to affect kidney. And you know, say all those things, your organs, they're very important for your body. So I beg, if you be woman, may you go check for, may you go do scan to check whether you get fibroid. And again, your period they irregular and your period they heavy, like doctor, right? Your period they heavy, may you go check for fibroid. So doctor, tell my viewers, Wetin if woman get belle and e get fibroid, wetin be the risks on that baby? If you carry the belle to full term, or possible?
Yes, there are many people that would have fibroids and they would carry the pregnancy to term. A lot of people do that successfully without a problem. But as I have said earlier, it depends on the location of the fibroids. If the fibroid is inside the lining, that's the submucous fibroid, right? It might cause recurrent miscarriages. So some people, instead of where the baby would implant, that is where the fibroid is. The fibroid is in the place where the baby is going to implant. So some of them might come with recurrent miscarriages, but not all. Some of them might have successful pregnancy because the uterus is large and there are other places the pregnancy might implant. So the person might have fibroids and might have a successful pregnancy.
Okay, thank you very much. And wetin be the treatment if person go hospital, say they diagnose am for fibroid? Wetin be the treatment for this fibroid?
Yes, the treatment of the fibroids depends on the size of the fibroid, as we have said, the size of the fibroids, whether it's symptomatic or asymptomatic. Fibroid will not cause any trouble. There's no need to attack it because you just have it by ultrasound scan and it is small and it's not giving you any of the symptoms that we have mentioned. So your doctor might advise you for a watchful waiting. After every 6 months, you go and repeat the ultrasound scan so that it gets more interested. Is it increasing in size? Is it giving you the symptoms, right? So if it's not asymptomatic, if it's asymptomatic, nothing is usually done to the fibroids. However, if it is causing severe symptoms that would affect the quality of life of the woman, she's having menorrhagia, heavy menstrual bleeding, lower abdominal pain, pain during the period, abdominal swelling, all these symptoms of complication, intermenstrual bleeding. Between periods, she would be seeing blood. Okay, pain during sex, and all of the problems we have listed. If she's having it and complications like anemia, because the bleeding might be much and she would be feeling dizzy, she would be feeling as if she wants to faint, she would be feeling headaches, dizziness, blurring of vision, palpitation. So the bleeding is too much that is causing severe symptoms. So she needs to be treated. The treatment can be conservative, meaning that's the watchful waiting that we have said. And the treatment can be medical or surgical. There are drugs that can be taken, okay, for the fibroids to be controlled. Okay, some of these drugs are drugs that would prevent the fibroid from growing further. Okay, the most common one is the combined oral contraceptives. That drug we get for family planning. So you're not using it for family planning, you are utilizing the hormones so that it prevents the fibroids from growing excessively, right? We can also give drugs that these are the hormones that can be given in the fibroids. There are hormones where the brain releases. Okay, so these hormones can be given to the patient, especially if the fibroid is too big. Before surgery, the drug would be given so that it shrinks the fibroids. Gonadotropin releasing hormone agonist and antagonist, all these can be given to the woman so that it shrinks the fibroids before that. Okay, so and there's some other drugs like tranexamic acid. Tranexamic acid can be given to reduce the amount of flow, to reduce the heaviness of the bleeding that the woman would have during the periods. Okay, there are other NSAIDs, drugs that would prevent the pain or reduce the pain. And other drugs like mefenamic acid can also be given. The mefenamic acid controls the bleeding and also controls the pain. So diclofenac and all of these NSAIDs can also be given to women with that. And estrogen, since we said these hormones depend on, this fibroid goes on, this fibroid depends on estrogen and progesterone. So you can give drugs that will prevent estrogen and drugs that would prevent progesterone. So antiestrogens can also be given. Antiprogesterones can also be given to prevent the growth of these fibroids. So if you have a failed medical therapy, you have these problems and you have been given had this drug, is not responding properly to them, the fibroid is too huge, it's causing these problems, you might opt out for the surgical therapy, right? The gold standard for treatment of fibroid is hysterectomy, to remove the womb completely. That means the fibroid would not reoccur again. However, in women that have not completed their family size, they're young women in their reproductive age group, maybe 25, 30, 35, they don't want their uterus to be removed. So what is being done is myomectomy. That means the fibroid would be identified and the fibroid would be removed successfully, right? So this is the surgical therapy, and other things can be done. Okay, arteries, umbilical arteries can be ligated. The blood supply to the uterus can be reduced, can be cut off, so the fibroids do not get enough blood. So there is no estrogen, there is no progesterone, and the fibroid would.
So sorry, let me cut you there. When the blood is cut off from feeding the fibroid, will it not affect the woman medically, apart
No,
from
it would
affecting
not.
the fibroid?
No, it would not. It's not the whole of the uterus that would be devascularized. It's step by step. Just the one that supplies that particular segment of the uterus would be cut off, not the whole of the uterus. Then there are other radiological items like uterine artery embolization too. So it's something that you would inject polyvinyl alcohol into it, and it can cause embolization of the uterine arteries, so the fibroids does not get the blood supply again. So it cures that. So these are some of the things that can be done to treat fibroids. But the gold standard is to remove the womb completely so that it doesn't reoccur. Because even after myomectomy, some of them would come down with recurrence of the uterine fibroids. Not all. Some would come back with the recurrence of the uterine fibroids because they still have the risk factors and they still have the hormones estrogen and progesterone. So this can cause a recurrence of the fibroids. But that is what is being done.
Okay, according to people, my viewers, them say before I come for this show, I don't do small research, and most of them the doc say apart from medical treatments, they get herbs where they shrink fibroid. How true is that? Is there a medical a herbs or spiritual way where they fit treat fibroid?
Honestly, I don't know any of it medically, that spiritual thing or herbal thing that does with removal of fibroids. Most of them would come in denial. No, I don't want surgery. I don't want surgery. I will try traditional herbs. They keep trying the
But
traditional
has it
herbs
worked for
until
any
they
of them?
yes, until they come back with the complications of severe anemia, or they come being rushed to the hospital because of anemia or one problem or the other. Then they would finally opt out for the surgery and the fibroid would be removed.
Okay, can you give my women where they listen right now advice on this fibroid matter, how to detect in case they not go hospital? Because some person don't tell me say they get heavy bleeding, they get pain. Maybe there's still other ways to detect, home remedy to detect, say okay, this one fibroid, make I rush to hospital. Any advice?
Yes, as I have told you, there are even some people that have the fibroids and they don't have the symptoms. So they can't even know they have the fibroids until they go to the hospital and they get evaluated. The doctor would ask them questions regarding all this that I have said. Then the doctor would examine them, examine the abdomen. Then he would investigate by doing an ultrasound scan. The ultrasound scan would tell you whether there is fibroids or no fibroids. So if you have the symptoms that we have said, you should go to the hospital, rush to the hospital, get an ultrasound scan done, and report it to your doctor. Report to your doctor, take the results to your doctor so that the doctor translates and see whether it's actually uterine fibroids or not.
Okay, thank you very much. Maybe we'll go to our message from our viewers. We'll see whether they send us any message. So, sorry, this message, the person they ask say whether man belle were big, whether na fibroid na cause am. Because they talk about women. Now, this my viewer, they ask say, he don't see man belle were big, na fibroid cause am.
Man's belly.
Yes, if a man's stomach is big, is it because of fibroid, or it's only women that can have fibroid?
Yes, as I have said, the fibroid is a disease of the uterus, and the men don't have uterus, so men cannot have uterine fibroids.
Okay, so this other message say, please, you go like to know whether it's advisable for the womb to be removed after childbirth. Can the womb be removed even though the person not get fibroid to reduce the risk of fibroid?
Yes, if the person has completed their family size and they want a hysterectomy done, it can be done for them, especially if they are high risk individuals and they have some increased chances for some maybe endometrial cancer, not for fibroids, honestly, endometrial cancer or any other problem, the womb can be safely be removed. Even for the fibroid, if the woman has completed her family size, because if the womb is removed, there are no children, you cannot bear your own children again. So if you are like maybe 55 or 45, or you have 10 children or 5 or 7, and you're okay with that, and you have uterine fibroids, you can opt out for hysterectomy, where the whole of the uterus would be removed.
Okay. Thank you very much. Thank you. I got it to I tell I say today if I go bring doctor come this place, make it come scatter ground for this fibroid matter. And I know say me I understand, but you where they listen and where they watch, I hope say you self get some many takeaways from this our gist today. So doctor, I want to ask this question for myself. If they remove a woman womb, whether they call an hysterectomy, e get any side effect apart from the fact say the woman no go fit born again? E get any side effect on the woman?
No, it actually doesn't get any side effect because the uterus has been removed. The woman would not have her periods because shedding of the endometrial lining of the uterus is what brings the period and the period blood, right? So she
Yes.
would not have her uterus, would not have any more children, and she is being protected from all this uterine cancer because there is no uterus, so there would not be any uterus where the cancer would arise from. So it doesn't have any side effects. However, in younger women, there is something we call post-hysterectomy syndrome. Post-hysterectomy syndrome, some people would come with depression, some would come with low moods, some would come with sometimes symptoms of perimenopause because some of the blood supply to the ovaries might have been severe and there would be decrease in production of some of these ovarian hormones. So they feel kind of like they're being pushed into a mini menopause.
Okay. Thank you very much. So we could not push this matter further. For you just to join us, if you go online to go get this remaining gist for there, and I promise you, you will be glad say you go online. And make we do a very short recap so that we no go lost. Say fibroid now non-cancerous growth for womb. Now, according to my doctor, it's not benign growth, no be cancer at all. And if it affects any woman from 15 years to 49 to 50 years. And some women no get no they even experience symptoms. And if it cause heavy bleeding and pain, say fibroid now automatically, not be, it don't mean say now automatical infertility. But early diagnosis and correct medical care, they're very important. Like my doctor said, say fibroid fit cause fertility. Why if infertility, I mean, why infertility again fit cause fibroid? So wetin dey cause fibroid na the fact say the womb don ready to carry baby, but the womb dey empty, so the womb needs to be occupied. Thank you, Dr. Adia Bashir Kasim, and thank you for breaking this topic down in simple language where everybody understands. Thank you very much, ma'am.
Thank you so much for having me. Thank you.
And to you, my viewers, as we always the advice, try listen to your body. If you dey experience unusual bleeding, serious pain, or delay in pregnancy, abeg, no fear, no shame, go hospital, run with your 2 legs, make they touch the back of your head, run go hospital, tell them say you want run scan. And if you get heavy bleeding for your period, so you dey see period, your bleeding dey heavy, and again your period they come out like cloth, they come out like thick blood, that one na another sign say it go mean say you fit get fibroid. Make you rush go hospital go do scan. And remember say for CHRICED Radio and TV, your matter na always we own. Don't forget to tune in for www.CHRICEDradioandtv.com and catch us on all our latest shows for social media at CHRICED Radio TV. My name is Fanilat Adamu. Make you enjoy the rest of your day and remember to stay healthy.